with some rehabilitative ways to manage these things. Okay, welcome back. We're going to move through an explanation of rehabilitative exercise, and it's in talking about this and specifically to degenerative joint disease, degenerative disc disease, and primarily back neck pain issues, what we see most predominantly in the practices. We're looking at this from a functional standpoint, and that is what we're trying to do is give people a simple way to do something inside of a very small period of time, that if you'll do just a few simple things most days of the week, most of the symptom of pain can be managed very successfully. So I have with me Suzanne, and Suzanne is my assistant in the office, and she is a great person to demonstrate how to do these things because she's very good at them. So I want to have you go ahead and lay back on your. The primary issue associated with starting with just the lower half and low back pain is we live in a flexion distorted society. We spend a lot of time sitting in chairs and bent forward, and where do we hurt? Well, it hurts when I stood up out of the chair, when I first get up in the morning, that type of thing. So when we start to address the body from a functional standpoint, we want to look at the musculature in a balanced way and deal with the entire kinetic chain of how things move. So I'm going to have Suzanne start with a basic knee to chest stretch. And the way you do this is you're just pulling the knees up until you get a good stretch. It will stretch the gluteus muscles in the low back, and you'll alternate legs from side to side. And all of these we would like to do a repetition of about 3 on each leg, and then you hold it for about a 3 count for each one of these, and that will be through each one of the different exercises that we're doing. And then go ahead and pull both knees together, okay? And this will then accentuate a little greater the low back stretch is associated with that knee to chest. Okay. In injured situations, when you hurt yourself, the first thing the body's going to do is it's going to recruit muscles that are not responsible for the motion to help stabilize that part of the body. And in this part of the body, that's the lateral muscles. So we want to start to lengthen these out. And the way we do that is she's going to bring this over, and it's going to stretch out all of these lateral muscles here. And she does so beautifully here. So I'm going to have you go ahead and go the other direction, and we'll just do each way once. And obviously if you're going to do one way, you absolutely need to go the other way. Okay? To all the golfers out there, how many times do you swing the golf club to the right? Have you ever swung the golf club to the left, unless you're a left-handed golfer? So there's no wonder that backs hurt from doing those types of things. Okay, so now we're going to do the hip rotator stretch. Now what we're doing here is she's taking that knee and crossing it just like you would with your, as you were seated, and the ankle stays here and you push the knee away, and this will then stretch these external hip rotators to get very tight in a pain setting. To accentuate that, she can then draw the opposite knee up, and it will create a greater stretch. Okay? And again, we would want to complete this on both directions, okay? So again, the legs cross, knee to a 90-degree perpendicular to the leg, and then you can accentuate it even more by drawing the opposite leg up, okay? We're going to go to bridges, and bridges are real important because in this flexion distortion that I mentioned earlier, we get inhibition of the gluteal muscles primarily. And when we talk about sacroiliac pain, between the sacrum and the ilium of the pelvis, the gluteal muscles are significantly involved. So you just raise the hips up off the ground, and she's only supported by her feet and her shoulders, and that forces the glutes to contract because they only engage once you go posterior to neutral point. Okay, and from here, that would be a fundamental series on your back. Okay, so I'm going to have you turn over onto your stomach. In this, we spend so much time bent over, we want to start to teach our body to go in the other direction. So we'll do what is in the yoga world we call cobra pose, or extension posture. And this allows these low back muscles and the posterior elements of the spine to be brought back, and allows the musculature that's associated with bringing us to an erect position to be shortened without them having to contract to get you there, because the force comes from the arms. Again, a good 3 repetition set is plenty. Now from here, that's full extension of this region of the body. Now go to child's pose, and this would be full flexion. Okay, and so this allows for a lengthening up these muscles up into here, as well as by having the shoulders engaged and down on the floor like this, you get a really nice stretch along the latissimus dorsi muscles and the superior erector muscles of the spine. Okay, from here we will go into the cat and camel. The spine is made up of individual bones, and each one of these bones is designed to move independently. And so what she's doing here is we're doing what is called a cat and a camel. She's arching her back up like a cat, and you just feel the stretch along here, and then you just allow that to sink down, and you allow the curve to go the other direction. And you will find limitations in motion, and you're trying to just make each one of these things become mobile. Okay? Now, fundamental in this situation is we have what is called cross-pattern inhibition, and we've all seen the people walk through the store and they walk like this, you know, and they never swing their arms, and that's because they've lost this ability to contract cross-pattern, opposite shoulder, opposite hip. This is an exercise that's fundamental to retraining that. She's going to take one arm and one leg, opposite sides, and extend them up. This will allow contractility across the area of concern, as well as, neurologically speaking, challenge the connection between the upper and the lower half. Okay? So this is a real fundamentally sound aspect to do a retraining. Okay? Now, all of these things so far are coordinations of movements and stretching oriented. And we want to do the one exercise that I guarantee can make a waist smaller for those of you out there that have that concern, and that is a plank. You have 3 layers in the abdominal wall. You have the rectus abdominis and the oblique muscles, and you have a deep muscle layer called the transverse abdominis, and this is the one that attaches from the spine and around the front. When contracted, it actually makes the waist smaller. It's also what is fundamental to core stability that is a big buzzword in the fitness world today. So Suzanne's going to support herself only on the elbows and the knees, and she has to hold this entire center in place, and this will allow her to be able to maintain muscle integrity throughout her ranges of motion and her activities of daily living. Your goal on this one should be to get up to a minute, okay? And so just to be able to get to that will be functionally significant. Okay, I'm going to come up to the hip flexor and the hamstring stretch. Now we're going to work on stretching out the hip flexors. And so as she rocks forward in this kneeling position, she stretches out the anterior hip flexors in here, and then rock back. And when she comes this way, it will stretch out the hamstring muscles along here. She can even accentuate it some more by drawing the toe up. Okay. Then so that would be a basic fundamental rehabilitation activity for the lower half. Now, degenerative disc and degenerative joint disease occur in the hip, in the shoulder, and the neck, and the mid-back as well. So we want to start to address the upper half a little bit. So I'm going to have Suzanne just kneel here.